coronary vasospasm or variant angina is a type of angina that usually occurs at rest and caused by transient vasospasm in the coronary arteries. So in acute coronary syndrome or in heart attacks, there is an issue in the inner wall of the artery where fat builds up and plaques, and then the plaques get ruptured. Here in Prinzmetal angina is different, as the coronary arteries are normal or has minimal fat, and what happens is the artery gets tightened or pressed or spasm. So think of it as a water hose, and you're pressing the water hose or pressing the artery, and in the other one there is an issue in the inner wall of the artery because of fat. So this type of angina usually present with transient ST elevation, usually less than 15 minutes, and may or may not occur with myocardial infarction. It depends on how severe the vasospasm is and how long is it for. Obviously, if it's completely occluded for a prolonged period, that will lead to heart attack. And usually the ST elevation would get relieved by nitroglycerin. Patients with Prinzmetal angina are often young and may have history of smoking. They might also exhibit vasospastic disorders like migraine or Ronin phenomena. And this condition could be associated with the use of recreational drug such as cocaine or amphetamine, as they lead to vasoconstriction. And the diagnostic criteria is angina that responds to nitrate therapy, and this angina typically occurs during rest or at night. Transient ST elevation, which gets relieved by nitrate. And the third is angiography evidence of reversible coronary artery spasm. And the treatment is usually by nitrate and calcium channel blocker dexamethasone, statin therapy and smoking cessation, and avoid the use of non-selective beta blockers as they may worsen the coronary vasospasm, and the use of aspirin should be approached with caution as they might increase the risk of bleeding. In patients where the spasm is significant that it leads to obstruction, PCI may be needed in those cases. So this is the midempire.com. Please join us. We have a lot of textbook of all systems of internal medicine and question bank for all system of internal medicine. Thank you.